Welcome, class, to mine and Stephanie's presentation over death, dying, and bereavement. My name is Amy Chacon,
And I'm Stephanie Carlson.
and we are excited to see you guys today for our workshop. And today, our workshop, our learning objectives will be covering understand what elders or terminally ill clients need when they are dying, distinguish different types of euthanization, identify leaders in the issue, apply death and dying to different perspectives, consider death and dying from multicultural perspectives, and understand the role of a death doula. Right here, we have our lovely handout, which will be covering today's objectives as well as we were talking about in the previous slide, Death, Dying, and Bereavement by Stephanie and I and myself. At the bottom of our handout, I included a quote that Stephanie had shared with me, and it goes, "Death is the most vulnerable thing we will ever experience in life." I think that was a lovely quote that summarizes what we go through when we experience death. I feel like this is a very sensitive topic, which is why we both decided to talk about it today. So we hope you enjoy our workshop. For those of you who are interested, you may take a screenshot of the handout, print it, so you guys may use it during the workshop at any given time. So with that, I will be handing it over off to Stephanie, who will be covering literature and review.
Okay, so first we're gonna go over a literature review, and we're gonna talk about communication while dying, dying from home, and euthanasia. And we're gonna go into detail about each of those different topics. Next. So first we're gonna start with communication while dying. So when we think about the ICU in a hospital, the intensive care unit, we think about a unit that works hard to keep people alive. However, 1 in 5 people in the US die in a ICU unit. Palliative care is an important part of working in ICU and includes both dying patients and their families, even after death. So according to the article Dying and Dignity in the Intensive Care Unit by Deborah Cook and Graeme Rocker, communication is very important with dying patients. Some of the many things that seriously ill elderly patients value while dying is effective communication and trust in the treating physician. However, most dying patients are introduced to unfamiliar clinicians during a time of distress. Another issue is that patients who get ill unexpectedly and die are not able to communicate their values on dying ahead of time, which makes it hard for family members to know what the patient wanted, and it causes higher levels of anxiety and depression. Next. So clear communication is a determinant of satisfaction at the end of life for both patients and families, so much so that family satisfaction in relation to communication is higher in family members of patients who die than those who survive. Next. So now we're going to talk about dying from home. So when thinking of dying, most people want to die at home. And according to heterogeneity and changes in preference for dying at home, a systematic review, there is a diversity in research findings about whether most people really want to die at home. However, most hospice centers are changing the home-based model of palliative care. Next. So when looking into the diversity in research findings, researchers have found that the answer to the question of dying from home or in a hospital changes throughout the illness. So the article states that because chronic conditions are becoming common, most people will experience a period of terminal illness. So dying in a hospital setting has remained frequent as people who want to die at home end up changing their mind when the illness progresses. So they want to die at home, but then when they need more medical care, they end up deciding to go to the hospital. And the preference of dying from home also changes based on what study researchers use. So when doing a phone survey, 52% to 90%, 92% preferred dying at home. But when asked in a church or in an emergency room, only 38% of people wanted to die at home. And when they conducted a survey in 2 counties in Georgia, 73% of people said they would want to die from home. Next. So now we're going to talk about euthanasia. So when we talk about euthanasia, we think about having a good death, but we usually don't think that there are different forms of it. So according to the final exit, the practices of self-deliverance and assisted suicide for dying, there are 4 different types of euthanasia in humans. There is passive euthanasia, which is also known as pulling the plug or disconnecting someone from life support. There is self-deliverance, so it's taking your own life to stop suffering, which involves no other person, it is just yourself. And then on the opposite side of self-deliverance is assisted suicide, which is when you take your life, but with the help of somebody else. Usually it's a physician administering lethal drugs. And lastly is active euthanasia, which is when a physician causes somebody's death by injecting legal drugs. So active euthanasia is not legal in the United States. And it's if a doctor, an example of that could be if a doctor sees somebody and they think they're suffering, the doctor would take it upon themselves to inject the lethal drugs. And that is not seen as ethical here in the United States. Next. So euthanasia through assisted suicide is legal in the United States. However, before someone decides to do it, they need to do a lot of planning. It is not just deciding you want to do it and then doing it. So first you would need to make the decision. So if somebody has terminal illness or they're just coming to the end of life and they're older, they would have to make that decision. Then look for the right doctor to do it, somebody that they have open communication with and that they trust. And then think about the hospice option. So when somebody goes into hospice, then it would be comfort care, and then getting together life insurance, and then just to discuss how they would die. And like I said, usually this would be through a lethal injection. Sometimes it could involve removing a feeding tube. Assisted suicide being legal does not mean it is easy or that it does not come without, or that it doesn't come without preparation. Next. So now we're going to talk about leaders in the issue. Next. So although there are many leaders, today we're going to talk about 3 main people when it comes to death and dying, which are Elizabeth Kubler-Ross, Herman Feifel, and Robert Kastenbaum. Next. So Elizabeth Kubler-Ross is a Swiss-born psychiatrist who created the 5 stages of death. So a lot of us have probably heard of it in our careers. They are denial, anger, bargaining, depression, and acceptance. Next. So the five stages of grief, which were invented by Elizabeth Kubler-Ross, were not studied on those experiencing somebody else's loss, but their own. These stages were conceptualized for those who were facing their own terminal illness, and they do not only involve loss in the form of death, but it can be in the form of anything important. So it could be the loss of a job. And during the pandemic, a lot of people experienced the 5 stages of grief when they lost their normal lives. So when they lost like normalcy. And she published many books, and her most famous one being On Death and Dying, which is where she presented the 5 stages of death. Next. So now we have Herman Feifel. He is the pioneer of the modern death movement. So he pioneered research in death and dying for more than 40 years. And he researched death back when it was taboo and people didn't really want to talk about it yet. And he wrote 2 major books and more than 100 articles and chapters about death and dying, including the volume, The Meaning of Death. Next. So his works have been published in journals across many fields, and this includes the Journal of Medicine, the Nurse and Social Work um, journals, history journals, religion, and popular media journals. And his work challenged the taboo towards dying, death and dying here in the United States. Next. So next we're going to talk about Robert Kastenbaum. And Robert is from Arizona. He's actually from Mesa, Arizona, and he died recently in 2013. He is an influential socialist and psychologist in the study of death and dying. So Kastenbaum set up research at Wayne State University and published a textbook on the psychology of death and dying. And again, just like Herman Feifel, he did this at a time where it was taboo to talk about it. He believed that each culture in society had its own death system where we either attempted to deny death or to accept it. Next. So by denying death, Kassenbaum means trying to hide death and repressing the idea of dying. So the United States is a state that has the death denying culture. And because of this, people try to live as long as possible, even though it means painful and uncomfortable treatments. So when people are terminal and they know that they're terminal, they'll still be willing to receive treatments that are painful, that make them feel sick, just because of the fact that they are so afraid of dying. And that's why we make dying very private also. And it's not as talked about than in other cultures. Next. So applications from a systems perspective. So next, we're going to look at death and dying from an individual perspective, from a healthcare perspective, and from a societal perspective. So when we look at it from an individual perspective, most individuals, death is a result of dying, of disease or many diseases that they have had to manage over weeks, months, or years. Dying is not only medical, but it's also social, psychological, and spiritual. And next, um, treatments are usually adjusted to meet individual patients' needs. So treatments could be anything from medication to physical treatments, like certain physical positions. Um, and many individuals nearing the end of life are not physically or cognitively able to make their own care decisions. So a lot of people who approach the end of life usually cannot speak about what they want. So it takes a trained healthcare professional to understand that individual person. Next. So the symptoms of death include pain. And when we talk about pain, it's not really in one specific area. People who work with the death and dying say that they don't usually know where the pain is coming from. And it's usually a pain that is very intense and they cannot describe. Then it's diminished appetite and wasting, which is also known as anorexia syndrome. So when somebody is approaching death, usually of old age, their body tells them they could stop eating. They also experience weakness and fatigue, which is called asthenia. So when somebody's approaching death because of old age, usually their muscles are weak because they were old and they get tired easily. They also have shortness of breath, which is dyspnea and cough. And when somebody is passing away, they usually do get their breath checked, and that's usually how you know how close someone is to the end of life. Um, Another thing about shortness of breath is that they get something called like a death rattle. So it's like a snoring effect, but it's not really snoring. They also experience nausea and vomiting, difficulty, difficulty swallowing, which is dysphagia, bowel movement problems, so like constipation or diarrhea, especially when a person is getting closer, they might experience both. So constipation while they're passing, and once they pass, they'll release everything. They experience mouth problems, so dry mouth, sores, dental problems, infections. They could experience skin problems, so itchiness, dryness, chafing, acne, sweating, or sensitivity to touch or pressure sores and dark spots. And depressing and depending on how close they are to death, pressure sores are not really an issue. They if we just allow them to happen as long as they're comfortable. Tissue swelling or lymphedema, accumulation of liquid in the abdomen, confusion, dementia, anxiety, or depression. Next. So when we look at it at a healthcare perspective, we're looking at it kind of like the microsystem. So nurses of dying patients are always encouraged to refer to family as they are dying because they're seen as the force of care. And nurses tell the family any information that they request. Next. So healthcare professionals are to assist the dying patient in spiritual well-being as well. So this being said, the healthcare professional cannot push their own view, but they're supposed to assist the view of the patient despite whatever it is. Healthcare professionals also help people die peacefully, and dying peacefully is complicated and highly technical process that requires focused education and training for healthcare professionals. So dying peacefully does not mean the same thing to everybody, and it is up to the healthcare professional to learn what it means to somebody and try to do the best that they can in order to ensure that they do, which does not always happen, sadly. Next. So one tool that nurses use in order to help someone die as comfortably as they can is to use the CARES tool. So first we have comfort, which means that they help with pain management or any comfort measures. Then we have the airway, which um, means to address any type of airway management. Um, so it involves the to treat any respiratory distress. So like we talked before, if they're having shortness of breath or they have like a death rattle, to make sure that their throat is open, stuff like that. They provide secretion control. So if there's any phlegm coming up that is causing the airways to get blocked, they would have to control that. And they make suggestions for educating family members on breathing changes, which are very common while somebody is dying. R is to designate the restless commonly observed in the dying. So usually when somebody is restless, it can be for any number of reasons. It could be that they're in pain. It could be that they're maybe hallucinating and they're trying to get up and go somewhere or with somebody, so you have to keep them calm. It could be caused by anxiety as well. E is emotional issues, which is common as well with dying and their families. Um, any spirituality is included in this section, which allows for a holistic focus on that kind of support. So if there's anxiety, depression, or any emotions between family, and the dying patient that has not been resolved. This is where we might bring up spirituality. And again, it's spirituality, which is that the patient believes in and not what the healthcare professional believes in. And S is used for self-care to address the impact that that death could have on the healthcare professional. Next. So then we're going to look at it at a societal perspective, which could be at the macro system perspective. So throughout human history, people have tried to remain youthful and attain immortality. So we see this when we see movie stars who get like facelifts or all these facials that people get in order to avoid wrinkling. Our healthcare system has changed from a healing first perspective and avoiding suffering to stopping people from dying no matter what. So instead of looking at what's best for a person in order for them to heal and not suffer, we'll do whatever it takes in order for them to not die, even though it might mean that they suffer. So during brief moments of consciousness, the patient could so right now I'm using an example from a book about a patient who was suffering, and in brief moments of consciousness, that patient would remove their tube several times. And although they were no longer able to verbally refuse the treatment, the patient was sending a very clear, strong message. And yet, each time he pulled out his tube, his feeding tube, medical staff kept putting it back in. And they eventually restrained his hands and his feet and kept insisting on reinserting the tube. And when they asked his doctor why he did that, the doctors made it clear that it was because if they didn't do it, he would die. So even though the patient wasn't comfortable, the doctor made sure that he did it because he didn't know if he didn't have that feeding tube, the patient would die. So humans define a good death as one that they control. So this means making decisions about how much intervention we want, how much pain relief we have, and whether it's in our home or our hospital, who will be by our sides, whether it's our family or friends or nobody. We even sometimes try to make decisions about what we will die from, but often, no matter how much somebody plans their death, dying usually doesn't happen the way we plan for it to happen. Next. So more than 90% of Americans want limits on their medical care at the end of life. So they don't want any long-term feeding tubes, they don't want any ventilation, yet most people usually will. Physicians are concerned about legal actions if they don't do anything possible to keep somebody alive and having their practices examined. So if they give too many pain medications, they could be investigated and it could generally cause a problem with their license. So there are many laws that are keeping physicians in that state where they have to do whatever they can to keep somebody alive, and they can't do too much to keep somebody comfortable when it comes to drugs because it could probably take away their license. Next. So now we're going to look at the multicultural considerations of dying. And to begin, we're going to look at death within the African American communities. So death that is mostly violent is familiar to the African American community. And the reason we bring this up in this slide is because most, according to the textbook, most deaths are violent. A lot of them may not die from natural causes due to aging. And then we have a quote from a book. says death in the Black community is perceived as a celebration of life, a testament to the fact that a life has been lived and that the earthly journey is completed. And this is by Parham Ajamu and White. Going to the hospital means dying in lower and middle class Black families. And for religious Black homes, dying can be seen as God's plan. And in some cases, all family members, close, close friends, and acquaintances are required to attend the funeral. And usually this means that there would be a delay in the funeral until everybody who needs to be there gets there. Next. So now we're going to look into death within the Native American community, but specifically the Lakota tribe. Next. So death for them is a counterpart of birth, and they're both very sacred. And they believe that afterlife is for everybody. It is not earned. They think that everybody who has lived and dies will get on the path, and this path will lead them to the afterlife. And death is not feared. So it is actually a part of being human. So to them, it is not something that they think they should be afraid of. Next. So they use expressions such as today is a good day to die when they're experiencing joy in life. So it doesn't mean it in a negative way like, oh, I just want to die today. It means this really good thing happened to me today, and I think it would be a really good day to die. And they also use death as a way to motivate children to do what's good. So they use it in the sense that you don't want to treat somebody poorly because you never know if they'll be alive tomorrow and you might regret it. But they don't use it in a way to cause fear, but to motivate them to be nicer to people. Next. And now we're going to look at death within the Buddhist communities. Next. So Buddha taught his followers to think of death as a means of understanding temporariness. So what it means by this is that everybody's life here is temporary, and they do believe in reincarnation, but our life, this life is temporary, and that's something that they need to, he thinks that his followers should understand. And in some Buddhist countries, monks meditate on decaying corpses in order to understand that temporariness. Next. So in Buddhist teachings, they refrain from using any cosmetic mask on the decaying body, and they accept death for its reality. So what it means by this is that in most cases, they won't embalm the body or put the makeup that we use here in the United States, and they will see the body as it is, and they accept death for what it really is. Next. They also believe that the better state of mind you have during death, the higher chance you have of having a favorable rebirth. So if you have if you don't have a good state of mind, you're depressed or you're angry, you might not have a good rebirth. But if you're content with what you did, you are content with what you did, you in your life, you will have a more favorable rebirth. And they have something called sutras, which are recording teachings of Buddha, and they believe that if you chant them sincerely, that it'll have a calming effect on the dying person. Next.
Alrighty, thank you so much, Stephanie, for sharing out all this information. I hope everybody else found this information very helpful. Now moving on to the next section, we'll be discussing a real world example with death, and we've chosen to talk about death doula. So what is a death doula? A death doula is an individual who works as a non-medical and non-judgmental support person for those who are dying. So, oops. Sorry about that. So What So there are different names for death doulas, and the different names that come with death doulas are an end of a life doula, a dying guide, a death coach, a death walker, a mourning doula, a death care, and a end of a life specialist. A death doula can go by different names. The reason for a rarity of names is that an individual selects their name based on their speciality and their personality. Even though with the different name changes, the death doulas may work a little bit differently depending on their specialty and their personality, but overall, a death doula does have the same structure and worth ethics as any doulas. So with that, what is the mission of a death doula? The missions of any death doulas are to provide education and to help those who are dying become familiar with the natural process of dying while assisting with lowering levels of fear and anxiety. So, who do the death doulas serve? The death doulas are able to serve the aging, the terminally ill at any age, the grieving for anyone who's lost a loved one or even lost a pet. And the death doulas are even able to help those who are technically not dying, who are just wanting to plan ahead and face their mortality now. Um, those looking to practically plan for end of the life at any ages, regardless of health status. So you could be anybody at any age given, seek a death doula just to make these end of the life choices. It's just to get a step of ahead. So it's really up to the individual. So the duels of a death doula. So what death doulas do is that, what deaf doulas do for the people that they serve is they engage in active listening with their clients and engaging in conversation with clients with offering non-judgmental support. Deaf doulas are able to support their clients' spiritual beliefs, preferences. Um, Deaf doulas may also provide holistic care, which is support that goes beyond physical needs of a person, but also considers their emotional and social and possibly spiritual needs. Um, Deaf doulas can offer physical support and healing touch, as such as holding hands with the individual, a gentle massage. Any physical care needs are usually left for the families to provide, like keeping the dying individual clean, dry, and comfortable. Death doulas are able to provide emotional support to the family of the dying while providing the family with education as well on the process of dying. Death doulas are to educate and empower of the natural process of dying while assisting the dying and family, while assisting the dying and their family on funeral and burial costs. Death doulas are even able to assist in seeking financial assistance for funeral costs. So the do nots of death doulas. The do nots of a death doula is to not inform what is the best way or right way to die. It is not the duty of the death doula to push their own beliefs or how to die, the duty of the death doula is not to push their own beliefs on how to die, what is the right way, and what is the best way. The death doulas are only to provide education on the options on dying when learning about available options. It is not the death doula's duty to share or push their personal spiritual beliefs. It is not their duty to save the soul of the dying. A death doula must respect the religious desires and beliefs of the dying. Um, Death doulas do not provide any medical treatment themselves. Death doulas are to only ensure that the dying have access to their medications that they need. So with that, a quote I wanted to share with class about death doulas is actually from a quote that I got from the book called How to Become a Death Doula. And the quote goes, "We must practice the art of dying. So when our death is upon us, we will not be afraid, but recognize it is as the most loving thing there is and fall completely into it. That comes from Reverend Olivia Barham. She was quoted in that How to Become a Death Doula guide. And this quote was shared in the beginning of the book. And the quote was to purposely show the meaning behind being a death doula and their mission, and how we should not be afraid of death. If anything, we should be inviting to it. So I really thought that was an interesting way to summarize what a death doula is. So with that, we have a class interactive activity. So for those of you who want to participate in the class activity, we will be using a website called Padlet, and it is going to be referring to what we've learned about death doulas. So I'll show you guys how it's done. So you guys will be copying, excuse me, you guys will be copying this link, padlet.com, SCA space 548/death doula. Once you guys get to it, bear with me. You guys will see this chat box. And basically what me and Stephanie has set up for you guys is this class activity. We just want to know your guys' feedback on what you guys learn about a death doula. As you guys can see, there are 4 columns at the very tippy top. 1, 2, 3, 4. It's only 4 questions if you guys would like to answer for us. Me and Stephanie have went ahead and answered the questions. I'll be more than happy to give a quick example of how to post. So for question number 1 is, did you know what a death doula was before the workshop? And if you're wanting to answer, all you have to do is scroll down to the plus button, and you're able to type in your name. I'll put Amy again. And then you will type in your answers go here. And then to make it even more fun, because we're just sharing our thoughts about death doulas, and it'd be interesting to interact with everybody. So if you're wanting to go out there and have fun, if you click on this little search button, you're more than welcome to add a little GIF on there to go with your comment. So let's go with happy to show you guys a quick example. And there you guys go. Just to have a quick, simple fun. So just a quick example is mine and Stephanie's answers. My answers is, did I know what a death doula was before the workshop? For me, I answered, before creating this workshop, I did not know what a death doula was. I was mind blown when I learned about death doulas and the positive impact they create on the dying. And I even added a little mind blowing, because I was very mind blown away by learning about death doulas. I really found that the topic was interesting and the role. So I will share what Stephanie had answered. And she answered with, I did not know what a death doula was before this presentation. I enjoyed learning about it. And she included a very cool GIF. So those are just one of the things you guys can do. I hope that everybody has a chance to participate in this interactive. I hope also Dr. Valancourt is interested in answering some of our questions and feedback. Like I said, we have some questions. Feel free to answer, everyone. So with that, that's the class interactive activity that we have going. So with that, in conclusion, we understand what is needed when terminally ill clients are dying. We develop knowledge on different types of euthanasia, and we recognize leaders in dying. We also can implement dying in different perspectives. We can also observe dying from a different multicultural perspectives, and we learn the role of a death doula. And with that, here are mine and Stephanie's references for our beautiful workshop we presented today. And with that, I want to thank everyone for watching our workshop. Thank you, Dr. Valancourt, for this class. With that, I'll hand it over to Stephanie to give her goodbyes.
Thank you guys for watching, and I hope you guys really enjoyed that. I know I really enjoyed that class activity that Amy did. Thank you.
Thank you, everyone. You guys have a great semester, and we will see you guys in the fall.